And welcome to the Thursday, June 24th briefing on COVID-19. We apologize for the delay. There were some issues at the stations getting a live feed, so we wanted to wait to make sure that they could pick up this briefing. So today we have with us our Director of Public Health, Matt Constantine, our Chief Administrative Officer, Ryan Alsop, our Skilled Nursing Facility Accountability Officer, Georgiana Armstrong, and our lead epidemiologist, Kim Hernandez. So I'm going to turn it over to Matt to get started.
Thank you, Megan. Good morning. This morning we are reporting 74 new COVID positive cases in Kern County residents and 1 death. We also, yesterday, after 5 o'clock, received 367 doses of remdesivir, and that is being distributed, was distributed partially last night and today to all of our 10 acute care hospitals. And I'm going to defer my skilled nursing facility report to Georgiana Armstrong, but I will turn it back to Megan for a report on the testing.
Okay, today we have a couple of updates to make on our COVID-19 testing sites. There are still the state-funded sites as well as the county-funded sites. We are approaching 12,000 tests completed since the beginning. The state sites, I want to remind you that they move depending on usage, so they need to maintain a particular level of usage. And so thankfully we're seeing an uptick in several of those locations. You have sites in Arvin at the Public Health Building, the Kern County Fairgrounds, which is a drive-through only location, the Wasco Library in Rosamond. Our county-funded sites also remain open. There is a change. The site in Oildale at Good Sam Hospital has now switched to 7 days a week and operates from 6 a.m. to 2 p.m. to accommodate the heat. The locations in Taft, Delano, Kern River Valley, Ridgecrest, Tehachapi, and Lamont remain open. And that concludes the information for our testing sites. I'm going to pass it over to Georgiana Armstrong to give an update on our skilled nursing facilities.
Thank you, Megan. I appreciate this opportunity to brief you on the actions the county has taken with regards to assisting our skilled nursing facilities to maintain their operations in a way that is safe for their staff, their residents. Last week, the county developed a comprehensive checklist and deployed 2 county staff teams. Those teams visited all 19 SNFs last week. We're compiling that data, and it helps us to build our understanding of the gaps that may exist and ways that the county may assist these facilities to address those gaps. The California Department of Public Health, CDPH, has indicated interest to partner with the county staff for future site visits, so those will be done, and those are currently being planned. Given the extraordinary impact COVID has had on the skilled nursing facilities, the county is taking extraordinary action to commensurate with the incident. We are focusing on the big ticket items, so to speak, and the first one is infection prevention and control. Each facility has an infection prevention specialist. The state has resources to assist those facilities. However, the county felt that additional resources in this particular area was vitally important. We are close to retaining infection prevention specialist resources that will be funded by the county under the CARES Act. And the purpose of that team will be to visit the facilities as an extra set of eyes to help identify gaps and issues that might not be noticed by the facilities, to provide guidance, training, tutoring, mentoring, consulting, and also to report back to the county so that we have an understanding of gaps and how the county might work forward to assist those facilities to address those gaps. Keeping the prevention out of the facility, keeping the infection from spreading within the facility must be our primary focus, and it is our highest concern. In most incidents, common in emergency management, it is important to gather input from what are known as stakeholders, and those are the organizations and agencies that have participation in a particular event. To this point, it has been the county, the state, and the skilled nursing facilities. But we recognize now that a key stakeholder group is not represented, and that would be residents in these facilities and their families and the staff working at these facilities. We believe the fact that they are on the ground, they are living this experience, gives them a unique opportunity to provide us with valuable information from their perspective, from what they see. So we are establishing a phone line, and we are asking for those constituents who have input and suggestions and ideas and want to raise issues that the county should investigate further. We want to have a mechanism to accept that input. We are working on an email that will be announced next week. That is not ready to go. However, a call-in function is active and ready to operate. The phone number is area code 661-868-0555. Let me repeat that number. It is 661-868-0555. We take your input seriously, and we appreciate any input you can provide to help us assist these facilities to better protect the residents and staff. Thank you.
Thank you, Georgiana. We're going to turn it over to our Chief Administrative Officer, Ryan Alsop.
Good morning, everybody. Today, in Kern County, population 900,000 plus, we are continuing to expand our testing throughout the county. We have tested to date 53,247 residents for COVID-19. 48,368, or about 91% of those tests have come back negative. We are seeking results of 697, or about 1% of the total people tested. 4,182 residents, or about 8% of the total tested, have tested positive. Today, of the 4,182 residents who've tested positive for COVID-19, 4,048, or 97% of those people, have either fully recovered or are isolated and recovering at home, treating their symptoms on their own. Today, 70 residents, or 2% of those who've tested positive, are receiving some form of care in an area hospital. 64, or 2%, of those who have tested positive have unfortunately passed away. Today, at least 29 deaths are being attributed to skilled nursing facilities. These are the facilities that were just discussed by Ms. Armstrong. We have 804 available hospital, regular beds in hospitals throughout Kern County. 804. We have 83 available ICU beds today. A little bit on the Kern Recovers program. The Kern Recovers loan program for small businesses. To date, we have distributed a little bit over $10 million in funding to 380 different businesses across 155 different business industries. The average loan is a little over $25,000. And it's taking about 15 days from application to having money in bank accounts. We're proud of that number. The turnaround is fairly quick. Again, we are asking all small businesses in Kern County who have not received federal PPP assistance to go on kerncounty.com. Right on our homepage, there's a link to the Kern Recovers program, and you can apply for some financial assistance at one of 4 financial institutions that are listed on our website. You do not have to be a member of those financial institutions in order to get this funding. So I would encourage all small businesses, again, who have not received PPP, whether you were non-essential or have been essential throughout this endeavor, please go online and seek financial assistance from the county through the federal CARES Act. Our PPE, Personal Protective Equipment Program, we're going to be distributing personal protective equipment to 5,000. We're targeting 5,000 independent small businesses throughout Kern County. That's a $5 million program. Information on that program will be forthcoming, and we're looking at July 1st as the program launch for that endeavor. Please go to, again, kerncounty.com to get information on that program. We are going to make PPE available to, we're targeting 5,000, again, 5,000 independent small businesses here in Kern County to receive masks, gloves, and other protective equipment, sanitation equipment, et cetera. A little bit about the governor's metrics and how the counties are continuing to be monitored by the state and how counties are monitoring themselves across 3 different critical areas that have to do with testing positivity rate, case rate, and also hospitalized patients. You can track our progress on this on a daily basis. There's a little bit of lag in the data, but on a daily basis, you can go to the state's website, which is covid19.ca.gov. I wanted to report that the 7-day average, that also has a 7-day lag for testing positivity rate here in Kern County, is currently 6.41%. The goal of the state is to have that below 8. We are below 8. We're at 6.41. Tomorrow we're projecting that we will be at 5.96% under that testing positivity rate category. Case rate per 100,000 people over a 14-day period. Today we're at 92.3. The goal is to be less than 100. We're below that goal today. Tomorrow we're projecting we will be at 81.53 on that category. The third category, dealing with hospital capacity, the percent change in the 3-day average of hospitalized patients. Today we're at 19.6%. The goal is to be below 10%. We are above that goal today. Tomorrow we're projecting that number to be lower. It will be 16.4, but still above the goal of 10%. That is a category we continue to watch. We go in and out. Earlier this week, we were below 10%. We're back up above. We're likely to go back down below. Again, in any one of these parameters, we go up and down, and these are conversations that we have with the state, targeting each one of these categories, having conversations about why these numbers are where they are, and what we can do with the state, working with the state locally to manage those numbers. I talked about the hospital beds and the ICU beds. Just lastly, businesses, please continue to follow the guidance that has been provided by the state, the public health guidance. If you're following that guidance with rigor, your employees are following it with rigor, you're communicating with your patrons who are coming in to your businesses. You have signage communicating this. If you're following that guidance, we are doing everything we can to help manage the spread of this virus. We believe that we're doing a great job as a county in the business community following that guidance. But we would ask today a big favor of our business community. Please have people coming to your businesses wear a mask. It's an easy thing to do. Post a sign on the door, no shoes, no shirt, no mask, no service. Just add a mask to that sign. That would be very, very helpful in helping spread the news that masks are a good addition to the regimen that we should all be practicing, which is good hand washing, distancing, not touching your face, cleaning surfaces, staying away from people if you're sick. All of those things, in addition to wearing a mask when you're in and around groups of people. Businesses, you can be a helpful participant in this endeavor in our community by simply posting a sign on your door and asking your customers to have a mask on. Now, for restaurants, people that are sitting at a table who are able to distance don't have to wear a mask, but when you go into the restaurant, you should be wearing a mask, and wearing a mask all the way to your table, and then you can take it off. But a big part of making sure that the community is wearing masks are businesses helping us out with this. It's a very, very easy thing to do. I went and filled my car up with gas this morning. I went into a Chevron. They had a sign on the door that said, wear a mask. I had my mask on. I went inside. Everybody in that facility was wearing a mask. Again, this is a very easy thing to do. Again, please, no shoes, no shirt, no mask, no service. If somebody doesn't want to wear a mask coming into your business, they can come back later, and you can tell them kindly, you might want to come back at a different time. You might want to check us out online, and provide some other options. Maybe you want to supply them with a mask. That would be a good thing to do. You can get masks to supply your customers with masks through the county's PPE program that we're getting ready to roll out July 1. So with that, we're happy to answer any questions that you might have.
Thank you, Ryan. So we'll follow our typical method. Remember, it is *6 to unmute. Our first outlet is KNZR. Do we have anyone on the line with questions?
This is Tony Lee from KNCR.
Go ahead, Tony.
And just wondering, with the way things are going, with more numbers coming in of people that are being tested positive, is that doing anything at all in the minds of the health officials that would change how, our opening up the county? Because there was some talk at one point that if the numbers went too high, we may have to walk that back a bit and close things down again. Where do we stand with all of that?
So that's a question for our Director of Public Health. Hang on one second.
Good morning, Tony.
Good morning.
So we do monitor the number of positive tests that we receive from all of our testing sites. Beyond the ones Megan has, we have a lot of other testing sites. I think there's a total of 54 when you look at all of the clinics and everybody else that's helping with testing. That number, though, Tony, stays pretty consistent. As Ryan indicated, it hovers somewhere between 5 and 8 to 9% positivity. That number is pretty consistent. Now, the question you're asking, though, is does that present some sort of concern or risk for the economic vitality of our community? And as Ryan also mentioned, the use of these guidance documents for our business sectors, I believe, makes that business even safer than it was originally. These precautions that our businesses are taking significantly reduces the risk of transmission. So as long as we're following that carefully, we're asking the employees to do it and the customers to do it, that ensures that we are able to remain open, that we stay off that watch list. It makes sure that the employees of that business are safe. I mean, you don't know if that employee is caring for a sick parent at home or an immune-compromised child. So, your ability to take that action, that individual action, helps protect the families of those employees. So it is something that we recognize is important. We want to continue to push for that and advocate for it. And I think testing is a key component of it. But today, I think we're doing well. We just need to continue monitoring it. Tony, does that answer your question?
Yes, it does. Thank you very much.
Okay, our next outlet is the Bakersfield Californian. Anyone on the line with questions?
Hello, this is Sam. Can you hear me?
We can. You're a little soft, Sam, so if you could speak up, that'd be helpful.
Okay, sorry. Is this better?
That is. Thank you.
Okay, cool. So my question today is following along the lines of what Ryan was saying about the masks. I know you guys have probably gone over this before, but just because I've seen a lot of skepticism about masks out in the public, is there anybody there who could talk about why masks work and what you guys would say to somebody who, doesn't think masks are effective at curbing coronavirus.
Yes, and we're going to have Kim Hernandez, our lead epidemiologist, respond to that. So give us just 1 second.
Good morning. We know there's a lot of conversations going on around masks. This is one of many of the tools that we recommend to reduce the risk of transmitting COVID-19. Face masks, cloth face coverings are intended as what we call source control. And so when I wear a mask, that is to protect me from transmitting to other people. And so what that does is that keeps any virus or other germs that we might be exhaling close to me and on my face. And that keeps it from spreading to the things around me, to the people around me. Wearing a cloth face covering or a mask is not a substitute for physical distancing. It is not a substitute for washing your hands. It is not a substitute for staying home when you are ill. All of those things still apply. This is an additional mechanism to provide additional protection. If you look in our healthcare facilities, for many, many years, our healthcare providers have employed this as a measure of source control in our healthcare system. So we are broadening it now outside of our healthcare system to apply to the rest of our daily lives to provide additional protection for all of those around us. We encourage people to talk to their healthcare providers about wearing them, and have the opinions of your healthcare providers, as well as follow the recommendations from the CDC, the recommendations from the California Department of Public Health. This is one tool used with many to help reduce the spread we have in our community. Thank you.
Thank you, Kim. Our next outlet is Channel 23. Anyone on the line with questions?
Yes, I'm here. This is Tori Cooper. Good morning.
Good morning. Go ahead.
So this question may be for Georgiana Armstrong. So we have had a chance to speak with the California Advocacy Director of the AARP. And what they told us is that they're getting multiple reports of nursing homes evicting some of their residents to make room for more lucrative COVID-19 patients because allegedly the more positive cases at the skilled nursing facility that they get, the more money they get. So we're wondering if public health has any knowledge of this happening here, and have you talked to the state about it? Have you guys seen any changes in the last 4 months? I know that you guys have had some conversations with them weekly, daily, but we're just wondering now if you guys have any reports of this happening and what's being done in terms of the communication between public health here locally and the state.
Thanks, Tori. We'll have Georgiana respond to your question.
Thank you. The skilled nursing facilities are highly regulated and have to follow certain criteria, and it is the sole responsibility of the California Department of Public Health to enforce those regulations. And what you are talking about, that 30-day notice, is a state requirement. So that is not something that the county has been involved in to this point, and it is not something that is within our scope of authority. The project that I've been assigned to by the Board of Supervisors is strictly focused on COVID-related issues as it relates to the skilled nursing facilities. So what you're discussing is beyond the scope of our project, and it is beyond the scope of what the county has the authority to enforce. My suggestion would be to reach out to the state and talk to the California Department of Public Health and ask them that question.
Okay, our next outlet is Kern Soul. Anyone on the line? Sorry, go ahead. Tori, did you have a follow-up
Hello?
question?
Yeah, I did. So our other question was, many other counties across the state have created a list of businesses in their local area that have received positive COVID-19 cases. And even our sister station in San Diego is also now wondering why Kern County is essentially one of the only counties that doesn't have a list of those businesses. And yeah, so that's what we're trying to figure out.
Okay, Tori, your question, we're going to have Kim respond to that, so give us just a second.
Hi, Tori. As we've discussed before, if there is a significant community exposure, we will absolutely be notifying the public. What we found in many of our case investigations is that most people who are identified as cases are close contacts of other individuals. A large group of these are people who are household contacts or are contacts in social gatherings or small settings, and that they are able to identify the close contacts that they are with, and that they are able to notify, as well as the public health department, notify and follow up with those close contacts. We are trying very hard to not unfairly penalize businesses who are doing the right thing, and that if there is a staff member at a business, hopefully those businesses have procedures in place to protect their other employees and the public. And so if there's a relevant community exposure, absolutely the public will be notified. If what we have in what we consider closed systems, where there isn't a need for a public notification, then all of those notifications happen through employers and through public health to make sure people who may have been exposed are made aware so that they can quarantine for the appropriate period of time and watch themselves for symptoms.
Thank you.
Thank you, Kim. Okay, our next outlet is Kern Soul. Star 6 to unmute. Okay, our next outlet is channel 29. Anyone on the line?
Hi guys, can you hear me? Tim here from channel 29.
We can. Tim, go ahead.
Great, thanks for taking the time. Couple of questions. I know Mr. Alsop was talking about businesses in relation to the mask. What about government buildings? Are you guys enforcing that folks who come into government buildings at this time have face coverings on?
Yes. Yeah. So the county administrative office and many of the others all have a requirement that to come into our buildings, you must wear a mask.
Okay, and then my other question is in relation to the private businesses, and again, I appreciate that they are private businesses. I saw yesterday that Governor Newsom basically threatened to withhold $2.5 billion in next year's budget to counties that don't comply with the different mandates coming down. Obviously, we do have a face mandate. And again, even though they're private businesses, are you guys at all going to look into more formal enforcement of that mask mandate, or are you still just going to strongly encourage businesses? What's the plan going forward if the cases in the state continue moving in a not great direction?
Okay, Tim, we're going to have Ryan respond to your question.
Thank you.
Hi, the state mandated it. I mean, it is mandated. The state, California came out and gave that directive, and it's mandated. We are making sure that everybody understands that that was the directive. And I think that one very easy way, if you want to talk about enforcement, is the participation of businesses in our community that are being frequented by people to have signage asking those folks to wear a mask when they come into their businesses. When they leave the businesses and they get in their car, they can take their mask off. They can take the mask off at home. We're continuing to communicate with everybody what the state guidance is as it relates to COVID. You know, for individual businesses, the mask directive. All of these things we are continuing to engage with the public on. individual businesses on. And again, I would just say that I think the governor's statement there was directed at some other counties, frankly, and some other individuals in other counties, as opposed to Kern. I don't think he was talking about Kern. I think we're doing a good job here, making sure that folks are following the state guidance. And again, it's our plea and request to the business community, who is doing a very good job following guidance, to please help us, communicate to your patrons that they need to be wearing a mask when they come in. Again, no shoes, no shirt, no mask, no service.
Thank you, guys.
Okay, our next outlet is Channel 17. Anyone on the line with questions?
Can you hear me?
We can, go ahead.
All right. I want to follow up on a question I had for Public Health yesterday about sports, specifically club team sports, also prep sports. I've got some local people here who are saying, hey, it's time to allow teams to practice, observing guidelines and recommendations and so forth, but time to let them back out there. And they cite a guidance document from the state about day camps. And what they have shared with me and what I've observed to be the case in San Diego County, among some other counties, they've taken the guidance for day camps, applied it to sports teams, and allowed those teams to practice on a limited and supervised basis. Why has Kern County not viewed those guidance documents pertaining to day camp in the same way San Diego County has?
Yeah, but we'll have Matt respond to your question.
Thank you.
Morning, Bob.
Morning.
This is a timely question. We've been working on this actively, and this highlights some of the confusion that's coming from the state. You've mentioned day camps, the guidance for day camps. There's also other guidance documents as it relates to recreational facilities and other outdoor events, and they all seem to not address the youth sports component. So we, in fact, have reached out now twice to the state asking for clarification, also recognizing that other counties have chosen to go against the order and to allow youth sports in some occasions, or at least talking about it. We've referenced and evaluated San Diego too. The state has very clearly told us in writing that youth sports are not allowed at this time, that they are developing guidance documents specifically for youth sports, and they expect those to be released soon. So at this point, we have been reiterating that message from the state, highlighting that it is not allowed under that current order, and we want to make sure we're doing everything we can to adhere to the order. Previously, we've talked a little bit about some of the discussion from the governor about not following the order, and we don't want to be in that position. We want to keep our numbers down. And again, those guidance documents really help provide some actionable, practical things that we can do to limit the spread within those specific industry sectors. Does that address your question, Bob?
Yes, thank you.
Thank you.
Megan, may I follow up on a different,
You sure can. Go ahead.
question? As I'm sure you're quite well aware, President Trump just a few days ago talked about testing and how we perhaps are doing too much testing. I am wondering if you have heard from any Kern County residents urging you to listen to the President's suggestion, observation, and reduce the amount of testing.
We have not heard from the group that's represented here today. We have not heard that feedback.
If you were to hear that feedback, how do you think you would address a county basically going against the President's recommendation?
So we're going to have Matt respond.
So Bob, let's see. First off, testing and early identification is a cornerstone to trying to address this virus. If we can test, and especially now we're detecting asymptomatic individuals, people that don't have symptoms that we're testing and identifying that they're positive, they become the potential spreader of this virus without even knowing they're sick, and they present a real risk to others. So testing those early on, identifying them, asking them to isolate, and then doing that contact tracing is key in prevention of further outbreaks. It's also important to recognize the state is judging us on the number of tests that we provide. That was a key metric that we had to meet before we could even ask for the stage 2 variants, that we had enough testing at a certain level to even meet it. Some counties didn't even meet that minimum level and then therefore couldn't even submit their application for that variance. So it remains critical for us to continue that. Our numbers at the sites that Megan has mentioned are up. The drive-through clinic at the fairgrounds, those numbers are doing really well. We have a new site in Roseman that did more than 100 yesterday and the day before. We are detecting that illness early, and I think that is key to flattening that curve and to keeping the numbers below so that our hospital system is able to respond. Anything else, Bob?
No, thank you. Thank you, Matt.
Okay, our next outlet is Telemundo. Do we have anyone on the line with questions?
Hello, can you hear me?
We can, go ahead.
Hey, Jose Gaspar here from Telemundo. So I got a couple of questions for you guys. First of all, as you know, over at Premix Farms in Wasco, some 31 farm workers, tested positive for COVID-19. As you know, the grape harvest is just about here, where thousands of farm workers, if they can find them, are going to be up here working the fields of Kern County. My question is, we've been hearing from farm workers who say that these companies are not giving them the adequate coverings that they need to work out in the fields. They're working much closer together than they should be working. Some of the people affected of COVID-19 at Premix Farms have contacted us saying, hey, look, the company that failed to notify us in a timely manner that so-and-so had COVID-19, so now we have it, and we're afraid of spreading it to our families. What is public health doing, if anything, to address the issue with farm workers and the upcoming grape season where thousands are expected to be out in the fields?
Thanks, Jose. I think we're going to have, yeah, hang on one second.
Jose, good morning. I'm going to ask Kim to help me with a response to your question. We share your concerns, and these are important individuals that we should protect. We have been doing much more outreach to our Hispanic community. We have some PSAs that I think you're aware of that are going to be coming out with some of our notable community leaders to help emphasize the need for taking action and being safe. We have a big meeting coming up in Delano next week with a number of the subcontractors for farm workers, highlighting the importance to take action now to ensure that as employers they are providing the necessary changes to their environment, to their employers' employment environment, so that we can control it. Each business presents some unique issues that we're going to have to deal with, and clearly that is the heart and soul of Kern County. We got to make sure that they are protected also. If you don't mind, Jose, I'm going to ask Kim to provide kind of the contact tracing and epidemiology side of this question also.
All right.
Hi, Jose. Good morning. Part of our case investigation and contact tracing process includes reaching out and working with employers and other businesses where they have an employee who may have an employee who is positive. Oftentimes, businesses also reach out to us. For agriculture in particular, we have spent many hours talking with various businesses as well as their subcontractors to educate and help them understand some of the best practices. We do know that in certain industries there are limitations on whether or not you can physically distance, and we are working with them so that they can develop their internal policies to keep their employees as safe as possible. We welcome any concerns that individual employees have so that we can reach out and educate their supervisors and management about effective measures to help keep them safe. This is something that has been done all along. We've worked with a number of employers to help them develop out their written plans, and then sometimes, and we often do provide feedback to them as we hear from patients that we interview about what's going on actually on the ground where they're working and ensuring.
All right, let me ask you this before you go on. Some workers, though, specifically at Grimway Farms, have told us they're afraid to speak out against management because they're afraid of retaliation. They would like to see, is there a whistleblower line where they can remain anonymous and speak in Spanish to denounce these conditions that they say are going on? We've heard from numerous people at Grimway Farms about this. I understand one death has occurred at Grimway Farms. So in the larger agricultural industry, as you know, many of these workers, because of their immigration status, are afraid to speak out. Have you guys thought about establishing a whistleblower line so that they can denounce these actions or at least check out these accusations?
So we currently don't have a specific whistleblower line. We do have our call center where we do take complaints. We have a number of patients who talk to the nurses who are following up with them, as well as our other contact tracing staff. Whenever we speak with employers, we never mention names. We never say who, we take, as we always have, confidentiality and privacy. We hold that to the highest standard. We talk to those employers. We tell them what we have heard. Sometimes we are hearing from a friend of a friend of a friend that this is going on, and we do reach out and we let them know our concerns. We hear, what processes they have in place and whether or not those are things that there are changes that they would like to implement and help work with them to help them make effective changes. I wouldn't call it a whistleblower line, but we do welcome those questions. All of the vast majority of the staff we have in our call center are bilingual and do speak Spanish, so they can give those reports, as well as we have nursing staff who speak Spanish, so they can provide that information in Spanish so that we can reach out to those employers, to those direct supervisors if that's so. We always maintain privacy and confidentiality. This is what we have heard from as the public health department, sometimes from multiple sources, and we do try to help educate all of those employers to continue to keep their employees safe.
All righty, so this Delano meeting coming up, this will be with labor contractors, is that correct?
Jose, I'm just looking at the invitation that we were asked to participate with the California Farm Workers Foundation. Hopefully I'm not speaking out of turn. It looks like it's a public meeting. It's a COVID-19 informational meeting, prevention practices, facts and myths, resources and information, social distancing, monitoring employee health. The notice here says Tuesday, June 30th, 11 to 1 at the Hyatt Hotel in Delano. So again, it's not our event. We've been asked to participate. We'll have 2 Spanish-speaking individuals. I think it also might be presented online, but that is coming up, and that's the event I was referencing.
All righty. I do have one other question from a viewer that contacted us. So I just want to throw it out there and see if this is even true. But according to this viewer told us that, not even sure if it's a he or a she, but they tested positive for COVID-19, but were allegedly told by public health, Kern County Public Health, that they were not contagious and that they could go back to work. Is that even possible?
So I'll ask him to try to respond to your question, Jose.
Hi, Jose. All of our case investigation staff, our nurses, reach out to those positive members of our community. They assess those members, and at a certain point, they are deemed to be not contagious. Once they are not contagious, they are released back to work. So without knowing details about this particular viewer who called you, we couldn't say for certain what happened in this case. But in general, all of our cases are assessed, and at a certain point in time are assessed as non-contagious, which is when they are released from isolation and allowed to go back to work.
Okay, so essentially you need more information about the specific case. Is that right?
Sounds like it. All right, thank you. I'm going to pause and see if any of our other stations have follow-up questions. Okay, that will conclude our briefing for today, June 25th, and we'll see you next week. Thank you.